This conference will now be recorded.
Hi class, we are continuing our discussion about the nervous system. We've already talked about the central nervous system and the peripheral nervous system as far as the sensory function goes. Today we're going to finish that conversation by talking about the motor structures and function of both the somatic nervous system as well as the autonomic nervous system, which we haven't talked much about yet. But it's really exciting because it's going to set the stage for your understanding of how your therapy as a massage therapist can be very impactful on an individual's health journey and have widespread effects in the body, as well as in a later lecture about how that can actually translate to pain relief. Yeah, so let's continue. So you're going to find this information from your textbook, pages 196 to 198, as well as, 200 and 205, that is not correct. Just the 196 to 198. In your workbook, you can check out pages 102, 108, and 109, as there's some exercises there that you might find helpful. So just to recap, the nervous system is divided into two divisions. You have the central nervous system and the peripheral nervous system. The central nervous system consists of the brain and the spinal cord, and the peripheral nervous system is everything else. Okay, that includes the sensory nerves, motor nerves, or sensory receptors, everything outside of the spinal cord and brain. And so the peripheral nervous system can be divided in the somatic division and the autonomic division, right? The autonomic division can be further subdivided into the sympathetic branch or the parasympathetic branch. That is like a fight or flight versus the rest and digest processes of the body that are not controlled by us. They're all involuntary and occur without our awareness, and really is maintaining homeostasis in our body and an balance. Okay, so this is more than you would ever need to know for a test, but it is worth discussing the anatomy of the spinal cord, just because there's some terminology that would be better understood if you are if we just revisit the anatomy of the spinal cord. So what I want you to pay attention to is the gray and the white matter. So here we have a cross section, a transverse section of the spinal cord, and we're looking at it as a slice. And you can see in the middle, there's a butterfly-shaped grayish, beigeish, it's supposed to be gray, gray mass, okay, like an H or a butterfly. And this is the gray matter. It's surrounded by the white matter. White matter consists most of myelin, so like the myelin sheaths that encapsulate or enclose around the nerve or the axon. And the gray matter is where there's cell bodies and synapses, connections, okay? So what I want you to understand is that you have an anterior and a posterior part, okay? So of the butterfly shape structure, we actually have horns is what we call them. So you're going to have the anterior or ventral horn or root. You also have the posterior gray horn and a lateral gray horn. Okay, and so what's important about this is understanding that the posterior or the dorsal gray horn is, maybe I should say this otherwise, okay. Getting you guys all confused, but the posterior is where the sensory nerves arrive to the spinal cord, right? They're the afferent nerves, A for arrive. They're bringing sensory information from sensory receptors to the posterior spinal cord. The cell body is actually in the dorsal root. So there's a little bit of an enlargement in the nerve that's stemming from the spinal cord. So there's a little bit of a bulb in the dorsal aspect, and we call that the dorsal root, or the dorsal ganglion. I'm sorry. The root is where the actual neuron or nerve connects to the spinal cord. We call that the dorsal root. And you also have a ventral root at the anterior aspect of the spinal cord, which is attaching the nerves, the peripheral nerve to the central. In the ventral aspect of the spinal cord, there is no ganglion. There is no enlargement or swelling because the synapse on the motor cell bodies is occurring in the dorsal horn, or the anterior gray horn. So the cell bodies are all located in this region. The other aspect, and what I really want to convey to you here, is that there is two divisions. So what we're focusing on today is the peripheral nervous system and the motor division, okay? We already discussed the sensory input coming into the nervous system, or the central nervous system. So we want to focus on the motor division, and there's two, right? We talked about the somatic motor neurons and the autonomic motor neurons. So in this diagram, the red motor neurons are somatic, and the green ones are from the autonomic nervous system. The motor nerves originate in the anterior horn or the ventral horn. They go by the same, right? Anterior and ventral are the same. So that's where the motor, somatic motor neuron originates. The autonomic motor neuron originates in the lateral gray horn. Okay, just a different section of that butterfly-shaped gray area of the spinal cord. Okay, like I mentioned, the peripheral nervous system is subdivided into two divisions, somatic division and the autonomic division. You can differentiate them by what they innervate. Okay, so the somatic division is innervating skeletal muscles only, okay, for movement. The autonomic division is innervating not skeletal muscles, but instead smooth muscles, cardiac muscles, and glands. These are the structures that we don't have voluntary control over in our bodies, but skeletal muscles we do. So just to kind of put that message back together a little bit more simply with less words, but more actions, I'm going to remind you about the reflex arc. The reflex arc always contains a sensory structure or sensory receptor, a sensory neuron, integrating neurons, motor neurons, and effector cells. Okay, so the sensory receptors are found in the skin, joints, muscles. They can also be found in organs, okay? And they're relaying information back to the central nervous system into the spinal cord. There they can synapse on other neurons that will take it up to the brain and higher brain centers, the brainstem, as well as the cerebral cortex for higher leveled decision making. Then motor neurons are descending through tracts in the spinal cord from the brain that synapse on that ventral horn, that anterior horn, okay, onto another motor neuron, secondary motor neuron, that is linked to an effector, which in this case is skeletal muscle. When we look at the autonomic nervous system, we can see the motor neurons originating in the lateral gray horn. And it also follows the same pathway as the somatic motor neurons down the ventral root, and then down the peripheral nerves. Finally, we will learn a little bit more about this. in just a moment, but will have an effector as an organ or a gland, like cardiac muscle, smooth muscle, or glands that will secrete. It's the motor pathways and effectors that differentiate the somatic and the autonomic nervous system from each other. So what I want you to remember is that the somatic nervous system has motor control over skeletal muscle and is voluntary control, where the autonomic nervous system is controlling smooth muscles, cardiac muscles, glands, and is involuntary. So I've already kind of demonstrated the reflex arc of the somatic division. We have been talking about this for some time, but the sensory receptors pick up that information, travel along the sensory neuron. Finally, there's a motor neuron that delivers information to our skeletal muscles for voluntary movement. And there's only one motor neuron between the spinal cord and the effector, right? It originates in the ventral horn and ends at the effector, which is skeletal muscle. There's only one type of effector, and it's skeletal muscle. Now let's contrast that with the autonomic division. There's a sensory receptor, okay? It's coming from the internal organs or the fascia. There's two motor neurons with an autonomic division, okay? That's different. There's also a ganglion, which contains the synapses of these two motor neurons in the autonomic division. In this diagram, I have a spinal cord. I've got this is a dorsal root ganglion here. We also have the autonomic ganglion, which is another swelling. This autonomic ganglion is unique to the autonomic nervous system. Okay, let's go back. The somatic division does not have that extra ganglion. So we have two motor neurons. We have a preganglionic neuron and a postganglionic neuron. Okay, they synapse at this ganglion, the autonomic ganglion in the peripheral nervous system. The effectors of the autonomic nervous system are only glands, organs, smooth muscles. Oh, I should have put cardiac muscles here as well. Okay, your slides will have that because will have edited it. So in the autonomic nervous system, we also have two branches, the sympathetic branch and the parasympathetic branch. These two branches really do maintain a balance, okay? You need a balance between the fight or flight response, like a response to stress or an alarm signal. And you also need to maintain homeostasis, tissue repair, and normal function through the parasympathetic tone, which is the rest and digest. If you have an imbalance in either of these two divisions, pathology might occur. For example, if somebody has an increased sympathetic tone due to stress, their organs of their body may not be receiving the right neural stimulation to do healthy tissue repair and maintenance. And over time, the organ may lose function and not work optimally. While that organ is very important, it's part of a system and the greater whole and can have some consequences and bring the body out of homeostasis and set the stage for disease. So visceral effectors, what I'm talking about there is organs, okay? Visceral means organ. So most visceral effectors have dual innervation. So organs will have both sympathetic and parasympathetic fibers innervating it. Yeah, we'll talk about that. Okay, so here's just a chart from your textbook, table 7 point 3, it gives an example of how an organ has both sympathetic and parasympathetic effects and how they're different, and they contrast them. We will be talking about this later, but I think it's really important to understand the difference. And part of your assignment will probably come from this information, knowing what the sympathetic effects are and what the parasympathetic effects are in general. Okay, we do come back and talk about these things in future lectures as well. I will never actually have this as being a memorization. So I don't expect you to memorize this chart at all, but I do want you to understand the themes and the contrast between the two. For example, with a sympathetic tone, that's their fight or flight, there's an increased heart rate. Okay, there's sharpened vision, increased breathing, right? Digestive processes they stop or slow down. A bunch of glucose or sugar is released from the liver. Okay, that's where our stored sugar supply is. It's released from the liver and put into the bloodstream. The sympathetic nervous system will constrict sphincters. Okay, so that you can't pee, right? It would not be useful to have to urinate when you're running away from a tiger. You have an increased metabolic rate, which is going to stimulate breakdown of fat, which is stored energy on the body, because you need a lot of energy to power those muscles to have superhuman strength to run really fast or to fight really hard. There's going to be a release of adrenaline, sweat production. When we'll learn more about some of these things when we talk about the endocrine system. With the parasympathetic effect, it's not as widespread, but you do have, it's kind of like a resting state, right? Rest and digest. So the blood flow, which in the sympathetic division is more in the muscles, in the head and the arms and the legs, and away from the organs, to power those muscles so that you can run really fast or work really hard. But in the parasympathetic division, this is optimizing fertility, digestion, and sleep for repair. Okay, and I put the yin and yang symbol here because that's how I think about it. I think about yang as being very sympathetic and the yin being very parasympathetic, and you need a balance between the two. Okay, so the basic structure and setup of the autonomic nervous system, the anatomy there, we've talked about it. We've talked about the somatic reflex arc. Now we're just talking about the component of the anatomy of the autonomic nervous system that's different and what you really need to know. Okay, so of course we're going to have the sensory receptors, okay, bringing information into the central nervous system. But we're focusing on the motor division. We're focusing on the peripheral nervous system here and the motor component. So we have the preganglionic neuron leaving the central nervous system, spinal cord, or brainstem, for that matter, through the anterior or ventral horn, traveling down and synapsing in the sympathetic ganglia onto a postganglionic neuron and innervating an effector, which is a smooth or cardiac muscle or gland. So let's focus on the sympathetic pathway first. The preganglionic neuron is going to exit the spinal cord only through T1 and L2, okay, through T1 and L2, so all of the spinal levels in between. And that's where the nerves are coming out of, okay? This is known as the thoracolumbar branch for this reason. In contrast, you'll see in a minute, the parasympathetic pathway is stemming from the cranial area and the sacral area. The sympathetic ganglion, where those synapses are occurring between the pre and post-ganglionic neurons, are connected together in a chain, okay? The chain is a structural piece of the anatomy of the body, and it's located anterior lateral to the spine. It can be called the sympathetic chain or the paravertebral chain. Nerve signaling can be transferred up and down this chain, and for this reason, it can have really widespread effects on the entire body. So one signal from our peripheral nervous system, one sensory input, can have a shotgun effect by affecting many, many different areas of the body all at once. And that's why when you have a sympathetic response, all of these things happen simultaneously. The increased heart rate, increased breathing, improved visual acuity, all of the sphincters constricting, the blood sugar raising. These things all happen simultaneously because of this paravertebral or sympathetic chain that connects all of the viscera to the one signal, right? Here's just the diagrams again. We're looking at the spinal cord anatomy in a little bit more detail. You can see the chain, the sympathetic chain, more clearly where it's located anterior laterally to the spinal cord. I know it looks really confusing, and I don't need you to draw this or label this for a test or anything like that. I just want you to kind of see more of an accurate anatomy of where all these ganglion are and how actually complex our nervous system can get. In the parasympathetic pathway, we have the preganglionic neuron, the parasympathetic. No, this isn't correct. Oh yeah, no, it is. The parasympathetic ganglion and the postganglionic neuron. The difference here is they are exiting from different places of the spinal cord. So we have the craniosacral, okay, divisions or branches happening here, rather than the like thoracic lumbar, which was the sympathetic. The other difference here is there is no parasympathetic chain. Okay, instead we have a very long preganglionic neuron with a synapse either very close, okay, to the effector or exactly in the effector in some of these organs. So here we have a terminal ganglion or that parasympathetic ganglion, where the preganglionic neuron will synapse on the postganglionic neuron, and the postganglionic neuron innervates the effector. Okay, so we'll have the terminal ganglion, or we'll actually have the terminal ganglion exactly right in the organ itself. So there's no chain. For that reason, the postganglionic neuron is usually shorter than the preganglionic neuron, and the effect is more targeted rather than widespread. And this allows for fine-tuned adjustments. Okay, and there's a couple diagrams again, reiterating the message of how there is no paravertebral chain, and the terminal ganglion are located very, very close in the vicinity of the effector. Here is just an overview, right? We're just comparing the two. What are the differences between the parasympathetic and the sympathetic branches? I've just summarized it here for you, exactly what I said. With the sympathetic, we're looking at T1 to L2, the thoracolumbar branch. We have the short preganglionic nerve, We have the sympathetic or paravertebral chain that's anterolateral to the spinal cord, and a shotgun effect on our effectors. The parasympathetic has the craniosacral branch. It has long preganglionic nerves going all the way to the effector. There's a parasympathetic ganglion that's located either near or in the visceral effector, and it has a targeted effect as opposed to widespread. Okay, so that completes our conversation about the peripheral nervous system, talking about the motor divisions of both the somatic and the autonomic nervous system. I hope you learned something and enjoyed this lecture, and look forward to talking with you again.